Hey gang, Dr. Eric here, Fanwood Back Relief Center. Today we're going to talk about mid-back pain and its various causes. The thoracic spine is the longest part of the spine. It runs from T1 all the way down to T12. And the spinal cord is within the column here. And then what we can't see on this model, are the ribs. The ribs attach here at the spine, and it makes an area of the spine that's the most stable. It also has the least movement. The neck and the lower back have more movement because they're not fixed with the ribs, the rib cage itself. Also, the rib cage is there to protect the vital organs innately, heart, lungs, all the major organs. We're not going to go through them all, but there's some very important stuff there, and that's why the body's designed like that. As the spinal cord ends around T12, we have an extension of the spine called the cauda equina. Kind of looks like a horse's tail, and that innervates all of the muscles of the hips as well as the legs as well. So we talked about it being a vital area, both for the organs, but also for the nerves as well. What typically happens is a lot of injuries that we see in the thoracic spine are related to either trauma, like falls, accidents, but we also see a lot of repetitive use injuries, a lot of poor posture, prolonged sitting, prolonged flexion of the head and the neck. Also scoliosis, where there's a curvature of the spine that we see earlier in early adulthood, teenage years starting into early adulthood, I should say, where there's a buckling of the spine. The muscles tend to buckle as a result of a growth spurt and cause the curvature of the spine. We also see from the side view, we have a lot of patients that come in with this rounding in the upper back. Okay, this hump we call it, Dowager's hump, and that's as a result of the head coming forward, pushing that area up. But a lot of patients come in with injuries in this upper back area, a lot of like stabbing pain into the shoulder blade. When they turn their head, they feel it into the shoulder blade. And a lot of that comes out of posture, overuse of those muscles, or poor ergonomics to say. It's usually the trauma that occurs to the ribs, either the rib popping out of alignment or a rib bruised or broken, is more direct force trauma rather than more of like an insidious injury like postural habits or doing things one-sided or repetitive use like we talked about. Regardless of what's going on, adjustments in this area, ensuring that the articulations are moving properly. If the ribs are actually out of alignment where they meet the spine, that can cause a lot of discomfort. But as a chiropractor, my goal is to minimize stress in this area and make sure that all these segments are moving all the way from the head down to the tailbone. Because if there's restricted motion, it affects the way it functions. Certain areas move and others don't, and it creates imbalances in the spine, creates inflammation, and if it gets into the nerve, it can cause more serious complaints. If you are suffering with mid-back pain, we look at the mid-back, but we also look at the areas above and below. It's all one unit. It's very important that we look at the whole picture and see what's causing the problem, whether it's referred or isolated to that area. If you're having pain in that area and you would like some help, give us a call, shoot me a message, I'll let you know if it's something I can deal with. You can check us out at fanwoodbackrelief.com for more information. And that's all we got today. Hopefully you have a great day, and we'll talk to you next time. So long. Thank you for listening.